Nisa Martinez. The flashcard. Today I'll be talking about a body system that I have enjoyed learning about these past few weeks, and that is the skeletal system. I've enjoyed learning about the bones and just memorizing where everything is located. A specialty that studies and diagnoses and treats diseases related to this body system is orthopedics. That is the branch of medicine that focuses on the care of the musculoskeletal system. There are different aspects to it, the surgical and clinical side, which I will be talking about. So orthopedists and orthopedic surgeons. Orthopedists are doctors, physicians that meet with patients and diagnose any issues related to the musculoskeletal system of the body. An example would be chronic pain from arthritis. They can diagnose and treat and manage that pain. They can figure out what the cause of that chronic pain is and minimize it. Some things that they could do would be suggest physical therapy and even pain management shots. So they help diagnose and treat any problems related to the skeletal system or the musculoskeletal system. Orthopedic surgeons can do the same thing. They can treat and diagnose any problems. The only difference is that they can perform surgery. They can, if need be that the issue needs to be resolved with surgery, they can do that compared to an orthopedist who would have to refer the patient to an orthopedic surgeon. Some surgeries that are performed by orthopedic surgeons are joint replacement, which is an artificial joint, either partial or total, that replaces a damaged joint, or something that we all know is a broken bone, osteotomy, which is when bones are cut or need to be repositioned in order to correct a bone deformity. An organ in the skeletal system is our bones, of course. I will be talking about the femur bone, which is the longest and largest and most strong bone in our body. Anatomically, it could be found superior to the tibia and fibula, inferior to the ilium in our pelvic girdle, and it is proximal to our knee. 5 important anatomical landmarks of this organ are the neck, which attaches the head to the shaft, the head, which forms the ball and socket synovial joint, the greater trochanter, the lesser trochanter, which are both can be attachments for muscles, and the gluteal tuberosity, which is the butt muscle attachment, the gluteal muscle attachment. The neck, head, greater trochanter, lesser trochanter, and gluteal tuberosity are all 5 important landmarks of the femur. The main function of the femur is to support our weight and stabilize our gait, which is our walk. But that's not the only thing it does, obviously. It's the attachment of muscles and other bones to it. And yes, that is a body system that I have enjoyed learning about these past few weeks, and I am excited to learn more.